Assalamualaikum warahmatullahi wabarakatuh. We are from group 3, consists of Syauma Hendrid N and me as Zulaika Zamri. The global elderly population at 65 and above is steadily increasing. This age group commonly experience polypharmacy, chronic illness, cognitive decline, and sensory impairment. Providing effective counseling is essential as it exchanges medication adherence and leads to better health outcome. So, why counseling is important for the elderly? Improve correct medication use. This is to ensure they take the right dose at the right time. And then the second is reduce side effect and drug interaction. This is to help prevent harmful mistake. And then the next is encourage independence. This is to help them make the informed choice. And then the last is strengthen trust. This is to build a stronger relationship between the pharmacist and the patient. The next slide is key consideration in elderly counseling. First, hearing or vision impairment. The second is cognitive impairment. The next is health literacy. And then the last is emotional needs. Effective counseling strategies. First, use open-ended question. Ask the question that let the patient explain, not just say yes or no. For the example, can you tell me how you take your medicine every day? And then the next is use the teach back method. The next is involve family member or caregiver if needed. And then the last is give written or visual aid. When a patient refuses counseling, some older patients may say no to counseling. The possible reason is they don't believe they are sick. They think they don't need the medicine. And then the next is they are afraid or don't trust healthcare worker. They might feel nervous or unsure about doctor or pharmacist. And then the next is they don't understand the language or culture. The last one is they think they already know what to do. They believe they have enough experience and don't need more advice. Ethical and legal responsibility. First, respect the patient choice. Every patient has the right to say no. And then the second is writing down, document the refusal. If a patient refuses counseling, we must record it clearly in their file. And then the next is make sure the patient understand. Check that patient really know what they are saying no to. And then the last one is offer help again later. Just because they refuse now doesn't mean they always say no. Be kind and offer counseling again during their next visit.
So in this slide is about how to respond when a patient refuses to counseling. So the first we should to stay calm and respectful, like don't get upset or argue with the patient. Respond and then be kind and show that you understand about their choices. And then the second is ask about their concern. Like we can ask why they don't want to counseling, or maybe they are afraid or confused, or they think that they don't need it. They don't need to have a counseling. And then the third is offer other option. If they don't want to talk to us, we can give them something to help them. Like we can give them a pamphlet or a brochure that consists of the information of the counseling, or we can ask a caregiver or family member to help them understand. And then the last is let them know you are always here to help. We can tell them that they can come back or ask question anytime. This can help us to build a trust for future visit for the patient. Okay, the next slide is about treatment and counseling approach. So the first we can check the patient's overall condition, like look at their physical health and then a memory and daily life situation. We can ask about that. For the example, do they live alone, or can they remember to take their medicine, because it's about elderly patient, right? And then for the second is go through all their memory. We can check if any medicine are no longer needed. I'm sorry. And then we can make sure there are no dangerous combination or side effect about that drug. And then the third is set clear and realistic goals together. We can talk with the patient about what they want to achieve, like to be healthy, to be not sick again, like that. For the example, keep blood sugar under control, avoid dizziness, or improve sleep. And then for the last is we can follow up regularly. We can ask the patient later if they understand how to take their medicine, or we can check if they are following the plan and if there are any problems. Helpful communication tips. So the first, we can look at the patient when talking, like eye contact. It can help the patient feel safe and respect. And then the second, use helpful tools. We can give them things that make taking medicine easier, like a pill box to organize the pill, or an alarm to remind them, or a printed schedule for when to take each medicine. And the third is ask for help from family or caregiver if needed. And then the last is talk in a way that encourage them, or motivational interviewing, like we can ask open-ended question, not just like an answer to be yes or no. And then we can listen carefully to what they say and gently guide them to make a better choices about their health. There is some cases from Mr. Ahmad that comes to the pharmacy to refill his medication, which is warfarin and metformin. In that time, he looks tired and said that he sometimes feels dizzy. When we asked him he would like to some help with his medication, he just replies like, "No need. I've been taking this for years. I know what I'm doing." Later, he mentioned that he forgot some doses, especially when he is busy or taking a nap. We as a pharmacy, we can respond by the first, we can shoot to stay calm and respectful, and we can say like this: "That's okay, Mr. Ahmad. I understand you are experienced." And then the second, we can ask gently about his dizziness and memory and the risk. We can ask like this: "Have you noticed when the dizziness happens, sir? It could be linked to how the medicine is taken, because warfarin affects blood clotting, and if we are missing a doses or taking too much, it can be dangerous." We can say like that. And then the third, we can offer a simple tools, like we can say like this: "If you like, I can give you a medicine schedule chart or a pill book, and then no need to change anything, I just want to help you to remember your medicine," like that. And then the last is reassure him. We can say it like this: "If you ever have question or need anything, I'm always here for you, sir," like that. So the second cases is from Mrs. Sari that has a prescription for ciprofloxacin, which is an antibiotic for urinary tract infection, and she is accompanied by her grandson. And when offered counseling, she said like this: "No need to explain. I'll just take it like I always do." So, as a pharmacist, we should to respond like this. The first, we should stay calm and respectful. We can say, "No problem, Mrs. Sari. I just want to make sure you get the best result from the medicine." like that. And then the second, we can talk to the caregiver. The caregiver, it means that this or Mrs. Sari accompanied by her grandson, so we can talk to her grandson. We can say like this: would you like me to share a simple schedule or reminds with you? Like that. And then the third, we should warn about important safety briefly, because this is an antibiotic drug, right? So we can say this antibiotic must be taken exactly as directed. If not, the infection might come back or might get worse. We can say like that. And then the last, we can leave the door open for future help. We can say like this: if anything feels unclear, you can always come back or call me. I'm here to help you anytime, like that. So the last slide is about conclusion. So counseling elderly patient is essential but requires special care. So if a patient reviews, we should respect their decision while still offering support and information. With a good communication, empathy, and follow-up, pharmacy can make a big difference in the health and quality of life of older adults. Thank you.